Good afternoon, everyone. I'm Dr. Manik Mathur, consultant neurologist in GNRC Dispur branch in Guwahati, Assam. Today we are here to discuss about a very common condition, which is cervical myopathy. Extremely common. So many people come to us with different complaints. So we are here to discuss and elaborate to the people that what exactly happens. So what we should do, because there's very confusing scenario in this. Some people think it's cardiac cause, some people think it's something else, it's a brain cause that is happening. So usually 90% patient presents with dizziness, a pain in the neck which is radiating to their either right or left arm, maybe both arms, and they have a tingling sensation in their arms. So these are the classic signs of way you can suspect someone with cervical myopathy. And secondly, also, when a person says that I'm looking this side, I'm looking that side, I feel dizzy. Okay, changing the posture in the bed also triggers cervical myopathy. Stress also triggers myopathy. Then, of course, plus high blood pressure. So these are all collectively tributaries getting into one, that is cervical problem. Very common. It's 90% people have cervical problems. So first thing is that any of such signs you have when you don't have any history of cardiac deformities, no history of any trauma history you have, so you suspect a cervical. The patient walks in, we check all the dermatomes of the cervical nerves, and we try to then evaluate by either going for a CT scan of your cervical neck or MRI. Now, usually in MRIs and CT scans, we see the bulge. So the bulge is something which comes between the two bones of your cervical bones, and they come and press your spinal cord. So that then causes all the radiation to the arm, which then causes tingling, pain, uneasiness, heaviness of one side, which is also in some patients I've seen that in peripheries where it has been attributed as a stroke. Well, it is not a stroke, it is cervical. So the first thing is very important is to give rest to your neck. You do not, if you're driving, if you are having a two-wheeler, try to go slow. Okay, number one. Number two, not lifting anything. Never lift anything for next 30 to 40 days. Complete bed rest if you can. And fourth most important thing is putting any muscle relaxant gel on your neck and then giving a hot fermentation, which is extremely important. Okay, so apart from that, there are tablets, there are medications which we give, for example, pregabalin, gabapentin, to relax the nerves which are getting irritated, to relax them and give you a better outcome. Plus we give other tablets, supporting tablets, nerve supporters, pain relief tablets. But remember one thing, cervical problems take around 3 to 4 months to get cured. They take a lot of time. Now, if you just scan a normal person who has no pain or no symptoms at all, will still have a bulge, because our sedentary lifestyle is like that. We are lifting things, we are more dependent on machineries, all those things. So that is why we do tend to have a problem of cervical myopathy. Now, in the normal person also you'll find bulges, but they may not have the symptoms. So we have to be very careful with lifting anything, driving, and then no handbags, especially for ladies. They do not need to have a handbag here. You need to avoid taking a handbag because your handbag is very heavy. It pulls your shoulder to one side. Lastly, blood pressure control, very important. People with cervical do have a high blood pressure, and which needs to be controlled. Whether you're already a hypertensive patient or you're a newly diagnosed hypertensive patient. In both the cases, you need to see your doctor. You need to see either cardiologist, neurologist, or a general medicine doctor to evaluate your blood pressure, see your renal profile, which then helps you to decide which medication to be taken. So all this collective workup will lead to a better outcome in a patient with cervical myopathy. Okay. So this is to conclude. Thank you so much, and we'll see you again. Thank you. Take care.